Facebook. I think
All
we're
right,
live.
here we are. We're live on Facebook again. Hey, you guys, did anybody come back for us? Woohoo! You know who we are? I'm Robin Swan, and this is
Elisabeth Mack.
And together we created the what's the name of our show?
Clinical Alchemy.
Clinical Alchemy, yeah. This is where the allopathic medicine person and the herbalist who is kind of like the nutty professor at this moment, my whole desk is going ballistic, get together. And we thought, okay, so let me just give you a little bit of background on how this came together. First of all, Mack is a very dear friend of mine, and she's really, really, really smart. In the last couple of years, we have just been pounding through what is cannabis as medicine. And every time I've done any kind of media thing on education around cannabis, she's always been my most favored guest because she has a wide sweep of knowledge that is not just in the cannabis industry, but also in the medical field. And something that is very lacking in cannabis medicine is the understanding of how plants and chemicals work together. So we thought it would be a really awesome idea and event for you guys if we came on here once a week and kind of demystified the whole thing for you. So Elisabeth,
an hour a week,
every Wednesday.
Not too hard.
Yeah, not too hard. 3 p.m. You can listen to us. You can share us. You can do all kinds of things after we record it. It's going to be a podcast. We're going to be all over the place. But mostly what we really want to do is demystify cannabis as medicine and separate cannabis as medicine from cannabis as recreational use. So this conversation is about how to use cannabinoids to heal your body and go forward in your life and reduce the chemical intake of pharmaceutical drugs. So tell us a little bit about yourself, Miss Mack. How did you come to this medicine of plants away from all of those horrible chemicals that had you for so long?
Well, thank you for our audience to being here. We're honored by your presence, first of all, and thank you, Robin, for queuing up this show and getting us together to be clinical alchemists. It's a pleasure to be here and talk about educating people on how cannabis works as medicine and why it is a medicine and not just something that is recreational to experience on a Friday night, and then think that there's no benefits to this plant, because this plant is one of the most amazing, complex, rich plants on Earth, and it really does heal. And the thing is, people don't understand this. And when we're talking about well, let me just go back up a notch and talk about why I got into here. And
yeah, let's hear about that. I want to know how you found your way here, because your story is very interesting. And you didn't find it till late in life. You were not a high school stoner like myself.
A little bit, but I kind of paid attention in school. But the thing is, I got injured. And so I came to cannabis medicine as a patient, like many of the cannabis nurses and other clinicians that are working in this field. Almost all of us that are pioneers have originated with the ability to use cannabis as medicine. And I was introduced to it at my chiropractor's office after a surgery, and her medical massage therapist was using CBD in the oil. And I said, "Hey, what is this? It smells funny." And she said, "It's cannabis." And I said, "Well, I don't want cannabis on my body. What are you doing?" And she goes, "First of all, it's just CBD. Second, it's a topical. It's not going to get you high. Third, it's going to lower your inflammation and help you get back to your pre-surgical arm faster." And I said, "Well, sign me up and tell me more." Right. And so pretty much on the way home, I stopped at the library and checked out every book I could on cannabis and cannabis medicine and how this works. And then I found all of these online resources, and I discovered like Ethan Russo, and I started like blowing my mind about the endocannabinoid system. And I said, wow, this is ridiculous. And so then I started to take CBD. And I found, so the person that gave me the massage was a representative for Cannabis. So early CBD that was flash dried Humboldt CBD in capsules. And I started taking them. And before you know it, guess what? I didn't need the Motrin. I didn't need the Flexeril. Like the 8 a day I was taking, I was like, I think I only need 2 a day. And now I go.
And what was the time frame of that? Like, how long did you go from taking 8 a day to taking 2 to not needing it at all? Or the occasional?
So probably about 3 months is that de-escalation in dosing. And so let's just say I started in January of 15, which is when that massage was, so 6 years ago. And probably by the summer, I was moving more freely and not taking all that Motrin. So I probably have the dose. And within a year, I went down to like one a day.
Wow.
Mm-hmm.
And how's your shoulder? I mean, I know that you've been through surgery with this shoulder. You've had a lot of rehab. So how is it doing now? And
The crazy thing is that I almost feel like I didn't have surgery.
wow.
I have rehabbed my shoulder to such a degree, and you know, you've seen my MRI. I still have 3 pinched nerves in my neck. I have structural damage. The first surgery back in 1993, they took an inch of my clavicle out because they said I had impingement syndrome and I couldn't move my shoulder. I couldn't brush my hair. I got injured by a patient. I was working psychiatry at that time, and I ignored it. And 6 months later, I felt like I couldn't move my arm. I was also dealing with emotional things, and people don't understand the bridge between mind body because we're so disconnected in allopathic medicine. And you just take a pill, you do a procedure, that's it. Forget about what's going on. And the house that I had just bought had construction defects, and it was raining inside the house because the roof was horrible. And the builder went bankrupt, and all these things that I found out subsequent to that. But I'm dealing with that, and it's my very first house. I was getting into an MBA program, working 7 days a week, and I couldn't move my shoulder, right? Like, did anybody talk to me? No. They're just like, let's cut this out. And, you know, it's like, what could go wrong? Well, you know, of course, downstream, all of these things change. Your body, the structure is always different. So in the last 6 years, since I discovered functional medicine and cannabinoids, and I've been treating myself differently, I have rehabbed this shoulder to almost where I don't notice I ever had surgery before.
And truly, I've known this woman for more than 6 years, and I have to tell you that is really it's a phenomenal recovery that way. And so it's amazing how our bodies can heal, and that's the part that I love about medicine is how we are all really interconnected. And when I was doing structural integration body work, I would always crack me up because I'd work on someone's feet and they'd be like, I felt that in my shoulder. Like, we forget that the knee bone's connected to the hip bone. Like, for real, like, we're really an interconnected species. And we're also just like a plant. You know, we only have 5 systems in our body, and we need oxygen and water, just like a plant. And the more chemicals you put on us, the worse we do, just like a plant. So, Elisabeth, what is so magical? Let me just ask you, what is so magical about cannabis and the human body?
Wow. You want to talk about the endocannabinoid system?
Ooh, what is that? It sounds so exciting. Well, endocannabinoid system. Who came up with that? We've become okay, here we go. We're now seeing Elisabeth.
Are you seeing my screen?
I am seeing your screen, yes, but we are starting with New York. So let's just take a minute since you put it up there and honor the woman, Crystal D. Peoples-Stokes, who brought the best legalization law to the New York State Senate. And this is the only state, and this woman, she really needs to be acknowledged and honored because she tirelessly worked on this law to make sure that people of color who are disproportionately arrested for cannabis crimes, that gap between Black people and white people in cannabis and getting arrested is minimalized.
Right.
Really excited about her.
You know, and America is progressing towards descheduling and taking it out of the Controlled Substance Act. Chuck Schumer is working on that, the senator from New York. But, you know, because we're going to talk a little bit about current events on this. And so there's a lot happening right now. But, you know, going back to how this is working, what we're doing is creating 2 systems, one for medicinal use and one for adult use. And what we call recreational. They prefer the term adult use. But the thing is, as we're progressing towards adult use, we need to be cognizant that the medical door still needs to exist, because what's happened in all of these states, we've got 36 legal states for medical marijuana and 15 states for adult use access. And every single state that turns, we lose the medicinal focus. We lose.
Right. And so we are going to do a whole, like our next show could possibly be on that, because there is a big difference between using recreational cannabis and using medicinal cannabis. And that comes down to how it's made and the amount that you're taking.
Yeah.
But it doesn't matter if it's recreational or medicinal, it's still going to benefit you if it has certain components in it. So first, let's get to how the heck does it freaking work, man?
And we do need to say that it needs to be descheduled, and so that people can get out of jail, because this is a real big deal. It's like Joe Biden said to Obama, with health care, this is a BFD, right? So this is a BFD too, because we're progressing towards getting all of these people out of jail. And that needs to happen as long as we still keep the medical door. And I'm going to talk about the ECS in a moment. But I just want to give a shout out to Andrew Cuomo. I'm still hopeful that he can pull this out. But who knows what he's doing? I just think that that's a good idea to get the cannabis legalized so that it can take some attention off of him.
But really, we need to, I know, because he's got a lot going on, poor Governor Cuomo. But really, Assemblywoman Crystal D. Peoples-Stokes is really the champion here. She is really the one who has tirelessly for years tried to close the gap between people of minorities and Anglos, the cannabis, like being arrested for cannabis. And also something else that she did in New York that hasn't been done anywhere is that she's creating a legal pathway for people of color and disenfranchised people to be able to open a business of cannabis, as
social equity programs. And so I'm on the board of Los Angeles Normal, and so the National Organization for the Reform of Marijuana Laws, and getting people out of jail, getting social equity programs so that there is advancement for people that have been marginalized and harmed by the war on drugs is critical. And so, just to really encourage our listeners, this is a legal substance with respect to CBD in all 50 states. There are medical programs in 36 states. So more and more people have this as an available option. So
which is why we want to have this conversation. So as your state opens up, as your ability to treat yourself with plant-based medicine happens, you're going to have a better understanding on how to do that. So God literally created you to use cannabis. And Elisabeth's going to tell us how.
Okay.
First of all, she's going to tell us all about how fabulous this plant is, in case you don't know.
It is
fabulous.
It's a marvelous plant. That was
marvelous, darling. Marvelous.
Simply marvelous, darling. This plant has been used over 5,000 years in humans for medicinal purposes. Back in Chinese and Middle Eastern journals on how they were talking about helping people for all kinds of different things. It's one of the richest plants on earth with over 500 different compounds. And we call them cannabinoids, terpenes, and flavonoids. There's about 140 cannabinoids that have been identified. The two most prevalent are CBD and THC, but there are a lot of companions that those have, along with the terpenes and flavonoids. And when you have good whole plant extracted medicine, you're going to get all of them. You're going to get the plant the way that God grew it, and then that can have specific medicinal properties. And the medicine is in the trichome. So if we're going to look at this, the thick purple sticky stalky stuff, that's where the good stuff is. And you want to make sure that you're doing business with somebody that actually uses these flowers and the buds to make the medicine, because a lot of companies are using trim and leaves and stalks and stems, and that's not good medicine. So you want
so just to stop right here, because this is a lot of information. So there's, like you just said, a mouthful. Okay. So what she's talking about here, folks, is the entourage effect. And this is something that happens with all plant-based medicines, is that we want to have the entire component of that plant inside of our body, because we are designed for it. And if you just take one molecule here and there and whatever, you miss this thing called the entourage effect, which is all of the flavonoids, all of the cannabinoids, all of the terpenes, everything that she's talking about, which is, and all of these companions to these two that we know, CBD and THC, are really the ones that are doing the work and getting those two that we know that get all the glory happening for our system.
Exactly. And on a future episode, let's break down extraction processes and how ethanol varies from CO2, just for a starting point.
BHO,
Um,
exactly. But
yeah.
we're going to go to that another day because that's a whole
Well,
hour.
no, I know that like, in future episodes we will do that. So let's talk about one of my favorite words, and it's called pleiotropic. When I give lectures, I always tell people in the live audience, say pleiotropic, because it's one of the most special words on earth.
Pleiotropic.
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 And I love pleiotropic because what it speaks to is effective efficiency. I love
I
efficiency.
love that.
And what this means is that it affects many of the physiologies all at the same time. So when you get these cannabinoids into your body systemically, and we're going to talk about that a little bit more next, but it activates things throughout the entire body. And so when people say, who is cannabis medicine for? It's for everybody. And here's why. Because this is modifying a system that connects all of our other systems, and it addresses all of these different conditions at once. And the beauty of this plant is that the phytocannabinoids, the plant cannabinoids, mimic the endocannabinoids. So now I usually
What
get
are the endocannabinoids?
what are the
Elisabeth, what
endocannabinoids?
are those?
What are the endocannabinoids? Well, let's talk about the human endocannabinoid system. I am the clinical geek and I love to teach this stuff. When THC was identified and broken down and the structure isolated and synthesized by Raphael Mechoulam, who is the godfather of medical cannabis, back in 1964, then he started to say, okay, let's figure out what this does in the body. And Mechoulam was actually financed by the NIH because we couldn't investigate this in our country because of prohibition, but the Israelis didn't see it that way, and they were like, "We're going to work on this." So we gave them $5 million, and he had 5 kilograms of hashish, broke it down, worked with that, and you know,
Wait a minute, stop there.
Yeah.
5 kilograms of hashish cost $5 million.
That's what he got. Look. There's a movie called The Scientist, and it's all about Raphael Mechoulam, and it talks about this journey. So all of you go to YouTube and watch The Scientist. But anyway, so it took until 1988 when we had the imaging that was available to us, where you could put THC and phytocannabinoids into the body, and to see where it goes, like where in our body does this go and what does it do? And what happened was when they put THC in the body in 1988, they discovered the receptors. They said, we light up like a Christmas tree. And these receptors are CB1, generally in the brain and the central channel, and CB2, generally in the gut and the immune cells. But literally, you have CB1 and CB2 receptors throughout your entire body, which goes back to the pleiotropic nature on what is happening here. And when the phytocannabinoids get in the body, they can activate all of these receptors throughout the entire body. And we've got more of these CB1 and CB2 receptors than any other receptor in our body. And what this does is provides the feedback between the cells to find us what we call homeostasis or balance. And they didn't say that the endocannabinoid system was actually discovered until 1992, because that's when they found the endocannabinoids. They were looking for from 1988 to 1992 when they found anandamide, Sanskrit for bliss, ananda. And then they're like, this is what goes into these receptors. Why do we have these endocannabinoids? And that's when they figured that they're activating homeostasis, or the retrograde signaling we're going to talk about in a second, that brings us back into balance. And THC plugs into these receptors like a lock and a key. And when we think about the locks are the receptors, the keys are the cannabinoids, and then of course there's enzymes that break it down. Those are the 3 parts to the ECS. But literally, this is all about balancing. And THC can activate these receptors to cause a specific physiological function. And therefore, we can use this as a supplement to bring us back to homeostasis and balance, because THC plugs in just like the key. CBD doesn't activate these receptors directly, but it's neuroprotective and anti-inflammatory.
Let's talk about what neuroprotective means, because people, that's a really good place to stop for a second. So can you kind of explain to us what's happening when something is neuroprotective?
Well, neuroprotective means that it is helping to protect and preserve the nervous system. When you think about nerves, generally you're thinking about them in the brain, but they're everywhere. And they need good, vibrant state of health. They need well-being too. But if we think
right here for a minute on the they're everywhere. Okay, so just so you know, if you don't know, when seed and egg crack and create a human, the first thing that we are is a nerve system. So first we're a spinal cord and then we're a brain. So when you say things like, I'm a bundle of nerves, you're not joking. You literally are. So this is what she's speaking about. She's talking about the entire thing that you are created from, a nervous system, a nerve system. Hopefully it's not a nervous system, just a nerve system.
But when we think about the brain, think about like folks that neurodegenerative conditions where the brain is shrinking literally because the nerves are dying. Neuroprotection is going to slow down that progression.
And
it's
what
going
kind
to
of a
slow
disease
down
would that be? Like
some of that cell death.
What would that, what something that would make your brain shrink would be like a
Alzheimer's, Parkinson's, neurodegenerative conditions. Yeah.
Yes.
And then think about MS.
Brain trauma of anything, even emotional brain trauma.
Yes.
You don't have to be physically hit to have your nervous system hit.
Anything that can cause and trigger inflammation. And that goes back to the CBD being anti-inflammatory. CBD is very anti-inflammatory, so is THC, but it's quieting the inflammatory process, and that is going to protect the cells. So like if you're speaking about a head trauma, people that have had a head injury that have CBD on board in the body recover much better, and the injury to the head is less troubling than it would be when somebody doesn't have CBD. Like if your kid is going to play high school football, make sure he's get a CBD capsule or something every morning so that he's protected, right? Because that's what we want to do. And in many ways, you know, this is what I call a river runs through it. Vince DiMarzo coined the term eat, sleep, relax, forget, and protect, talking about the endocannabinoid system, because this is all of the different physiologies that intersect with this ECS. And when we have a good, healthy endocannabinoid system and things are working, we're making the endocannabinoids, the receptors show up as they need to keep us balanced, and everything's working right, we are in a good state of health and well-being. When we have an endocannabinoid deficiency, we have disease. And right now, there's no lab test that you can take to see whether you have enough endocannabinoids to be well. But what we're finding is that if you are functioning and you're not sick, then you are said to have a good ECS tone and health status.
So what about smoking pot, Elisabeth? If I just smoke a lot of pot, am I going to feed my ECS?
Well, you know, that's another episode where we can talk about the different routes of administration and how you get these phytocannabinoids into the body. My favorite is a tincture because I believe that gives us the best systemic access. But if you smoke a joint, you can still get the cannabinoids into the system.
Right, but you're going to get much less. So just briefly, we can always go back to this one. But the way that you use cannabis, the way that it breaks the blood-brain barrier, matters very much on how it. Oh my God! How is it possible my phone is ringing?
Well, we'll just mute you out for a minute, and you can answer the call.
No, I'm good. I put it on silent.
But I'm going to talk about these receptors because even if you smoke a joint, the receptors can still get activated. So let's talk about what retrograde signaling is and how this works. Because normally cell transmission, when your cells are communicating with each other, and they are constantly every microsecond, this is cell A and this is cell B. And normally the transmission goes one way. But what happens if this cell in B could not have a message going back to cell A to say, hey, adjust something up or down. I'm not doing well here, and we've got something downstream that needs to be fixed. Well, this endocannabinoid releasing from cell B, going back and plugging into the CB1 or CB2 on cell A is what's going to give a message. And then that code is going to then change the flow of neurotransmitters, and we're going to fix the situation. And this happens everywhere in the body, which is why that word pleiotropic really starts to make sense.
So literally, if you start using products that are quality products and you start feeding your endocannabinoid system, like you literally are restoring your central nerve system. and you're regrowing the myelin sheath and you're repairing the damage. So just briefly, how humans, when humans get sick, when we have issues, it's because there's death in the nerve cell. So first the nerve dies, then there's no pulse, there's no blood, there's no heart pulse, there's no oxygen going to that area. Those cells start to split, and this is how cancers are formed in the body. So this is a way to slow that down. Can't use the word prevent. This is a way to slow that process down and make sure those cells are always being fed.
Well, yeah, and we want our immune cells to stay healthy and vibrant rather than diseased and growing cancers. Cancers are just rogue immune cells that might mutate and they lose their off switch and they just keep growing. And that happens because this didn't happen. The retrograde signaling wasn't happening in whatever area that tissue became sick, and the feedback wasn't working. And so just two more slides here. We're just talking about the endocannabinoids and what they do. But in this case, let's just say somebody's having a seizure. We're normally talking about kids, but that's an imbalance between GABA and glutamate. GABA is calming, glutamate is exciting, right? And when you have excessive glutamate, first of all, our brain is jiggering, and we're all anxious. But it could also be triggering a seizure, which is what happens. And when you put CBD in the mouth of a child having a seizure, the seizure stops because CBD is getting in there and it's helping the endocannabinoids work better so that this message can equalize things and bring that body back into homeostasis, stopping the seizure. And we have an ECS tone so that all of our cells have that set point. And to Robin's point about the cancer cells, when we lose our ECS tone, we are sick. And cancer cells will show expression of these receptors, CB1, CB2, on their cell membranes looking for endocannabinoids. But what if the body's not making endocannabinoids to fill that gap, to be able to give that message? That's when we get really sick. And
also, so when we get really sick, we don't just get really sick. Okay. Like all of a sudden you just don't have cancer. All right. Cancer needs to grow in the body. Oftentimes it's been growing for 10 years before it's even detectable. So when, like Elisabeth just said, if you put CBD into the mouth of a child that's having a seizure, those seizures will stop. Yes and no, because I just want to make sure that, we're really having a lot of integrity in our words here. And we don't want you guys going out and testing, of course, test what we say and it will be true for you. But also just the level of education here is that the more damaged the system is, the more time it takes to repair. So you can't be a total freaking mess, use cannabis one time and be like, oh, I'm not better. What the hell? Those ladies are crazy. Okay. So we need to have that time in our body for restoration. And I like to say that about cannabis as medicine is that the more you use it, the less you need it, because you literally are restoring your system. But just to be really clear, it might not stop your child from seizuring the first time you put it in their mouth. And if you continue to use it, you will see a noticeable improvement in that child or in yourself.
And so, to Robin's point, it's not going to, mitigate that instantaneously. Sometimes it does. But basically when we're treating seizures with CBD and CBDA and THCA and THC and CBG, all of the other cannabinoids we'll talk about later. But the idea is you have to get to a tipping point where the potency of what you're using is enough to trigger the response in the cells to actually change that and to reverse course and to correct things. And what we're trying to figure out in clinical medicine and care on this is at what points, and that's always going to differ because each child with seizures is going to have a different threshold. Some people are going to be very receptive and right away it stops. And some people are going to need 600 milligrams of CBD a day to make that stop. And we all bridge the gap in between all of these different
and this is where this is really an important point, because this is where plant-based medicine differs greatly from chemical medicine. because they can give you a certain amount of milligrams of ibuprofen or something like that, and it's gonna like work pretty much the same for everybody. Like everyone, you know, is gonna pretty much be in the same zone of 800 milligrams for a headache, right? But cannabis or plants, they don't work the same way because they're more like homeopathy, and that means that they come into alignment with you, your individual, your thumbprint, however you are. So there's a little bit more tweaking.
Absolutely. And it is. And chronic stress is what's down regulating the system. Bad nutrition, chronic stress, not moving, not speaking up and setting boundaries and holding emotional pain, and not sleeping. So if you sleep well, you have a good, clean diet, you're setting your boundaries, speaking up, keeping work-life balance, then you're gonna be less in deficiency and better off. So we want to heal this system and keep it balanced, because if the ECS is off, so are we. And again, this speaks to the clinical potential of what's happening in the research.
Go, what the heck? Like I feel like I'm like on some kind of like massive trip when I look at this thing. Like,
Well,
what?
I know, but yeah, when you think about who can benefit from cannabis medicine, right, and cannabis
Anybody with
therapeutics,
a mouth.
this is a research slide. So this talks about the ability for CBD and the other phytocannabinoids to have all of these medicinal properties in the body, but this remains preclinical. And what preclinical means is that it is not studied in humans. It's still in the cell cultures and the mice and the rats and the rodents and that sort of thing in the lab. This is all lab stuff. We're doing this in clinical medicine with our patients, but we're still pioneering this. The scheduling of cannabis in Schedule 1 disallows us from studying this in humans to the full extent that we need to. But this is what they're finding in the lab on all of these medicinal properties. Do we have anything in the chat as far as questions on people asking about these sorts of things?
We have blown them away with so much information. They have not asked us one question.
Yeah, that's what I was wondering, if we
Yeah,
hadn't.
so like let's slow it down just a little bit. Because this is such a like this chart is literally like what? Okay, because like I want to just bring out a couple things that people might be curious about, like THCA and THCV, because like we get a lot of conversation about CBD and CBG and CBN, but THCV and THCA are two really unsung heroes that are not psychotropic, that don't get you high. So can you just share a little bit about like who are they in the plant? What do they do?
Well, there are the phytocannabinoids that are activated, like CBD and THC, and then there are the raw or the deactivated, or just in its natural form, CBDA and THCA. And you have to process them. You have to heat them to free a carbon molecule particle, so that you're able to activate it and create CBD from CBDA. Or THC from THCA. And each of them have their medicinal properties. And so all of the clinicians and researchers are arguing, should we be using the acidic versions or should we be using the activated versions? And the answer is, it's always a little bit of both, right? Because even when you have something that's been processed, you might still have a little bit left of CBD and CBDA. And then herbalists and alchemists like Robin that are making these different formulations can then, in through the extraction, separate out some of them and reintroduce them later if you wanted to, or at least the people doing CO2 extraction can do that.
Yeah, and it's
a
really
whole other thing.
It's nice to be able to bring something down and bring something up depending on what exactly you're trying to do with it. So even though we over here at Firebird do full plant extraction, and then we use heat and secondary extraction methods to do things like make the CBD higher, or whatever we're looking to do, like
and have different ratios, right? And different blends
and flour as well. Like this all comes at because we're using So we're using live plants, right? And this is like another conversation, we could get into it deeper, but you know, the color of your flower matters. Like older flower is very high in things like CBN and CBG, and it makes it very sedative. So if I'm making something for somebody who has Alzheimer's or Parkinson's, I'm going to want to use a more broken down plant material than something that was just cut yesterday, because it's going to be higher naturally occurring in that older plant medicine, because the THC has, you know, the V and the C have broken down a little bit more. So
Yeah.
there's a lot of nuances, which brings us, before we go to the next slide.
Yeah, but
about-
you know what? The beauty of good whole plant medicine that like Robin makes is that you get all of these phytocannabinoids. You're not getting just one or the other or in an isolate. You're getting whole plant medicine, which gives you all of it. So that when we get to this slide, now we could say this is the preclinical potential. And I call it a medicinal treasure trove because it can literally help us modulate just a little bit each one of these systems. And it really kind of blows your mind. But from a neurological standpoint, we can level out that GABA glutamate so we can reduce the incidence of seizures, reduce the severity of seizures over time with cumulative dosing. We can also straighten out neurotransmitters for people that have other kinds of imbalances and nerve dysfunction. In psychiatry, we can use these phytocannabinoids to lift anxiety and depression and suppress some of that panic and fight or flight and PTSD using these phytocannabinoids, because they're activating things in the brain from that other slide that we talked about that is bringing us back into balance in the amygdala, calming down that fight or flight center, in the hippocampus, restoring our memory, in helping to correct things, improving blood flow in the brain. You know, we can talk all day about each one of these.
Brain medicine, like honestly, cannabis really just feeds your brain.
Mm-hmm. And then on the autoimmune conditions, think about the inflammatory process where and you saw the nerve cells and the retrograde signaling. So now imagine somebody's got an inflammatory process going on, and so that those cells are not correcting because once they're off, unless you have endocannabinoids, you're going to stay broken. You're going to stay off. Essentially what happens is that the inflammatory process runs away and the body can attack and heal itself because the endocannabinoids help the messaging to say, hey, turn something off. I've got enough of a response. And so when you put the cannabinoids into the body systemically, over time, they can start to modulate that and lower the immune response so that people with autoimmune conditions might be able to balance out a little bit. Oh. Imagine that. And, it doesn't hurt. So when I think about, people with autoimmune conditions that are taking all of the immunosuppressants, right? And you see them advertised a lot on the news because a lot of people have this issue. 50 million adults have autoimmune conditions, and these immunosuppressants are dangerous to take.
Why do you think that 50 million adults have autoimmune conditions? I mean, that seems excessive.
I know it sounds crazy, but globally, that's where we're at. Not necessarily in America, but globally.
Like world stress, like just the world is just so stressed out that we're just like frying our immune system.
Well, so a lot of this goes to diet. It goes to processed foods. It goes to toxins and environmental issues. It goes to not taking self-care seriously and that sort of thing. Autoimmune conditions can generally be helped with lifestyle medicine. And what I teach people to do is use the phytocannabinoids to enhance lifestyle medicine. What do I mean by lifestyle functional medicine? Clean diets, anti-inflammatory diets, fruits and vegetables, lean proteins, eliminating some of the gluten and dairy and sugar if you have allergens, and looking for some root causes. And then movement. How many people they start hurting and they stop moving, right? And that is one of the big problems for sure in chronic pain management, but even in autoimmune conditions, because they hurt and they don't move. So how do we use cannabinoids to get people to be able to move again? That's huge. So the phytocannabinoids are fixing the inflammatory process inside, but they're also helping us be able to stop hurting so much so we can go for a walk, so we can do some stretching, so we can do some floor yoga, like what I do every night now with the assist of this plant,
Right.
And
Yeah, there you go.
cancer.
List of the plant. So someone asked for some more information on how CBD plays into addictions and cravings.
Well, that's at the bottom. Let me go through a couple more of these things first, and then I'm going to close with that. And this is our last thing. But on the cancer, there are preclinical studies that show that the phytocannabinoids have anti-tumor properties. And what are we looking for as clinicians for anti-tumor properties? The ability to trigger apoptosis. All of our cells have a start date and an end
word. I love that word. But like that goes right with your the other fabulous word, the phytocannabinoid
protection.
Yeah, that's another one. So what does that mean, apoptosis?
So
Like
I was just saying that. So all of our cells have a start date and an end date. And the end date allows that cell to realize that its time has elapsed and it needs to auto digest and basically turn off and allow the body to get rid of that cell through waste, right? And there's biological properties of, this is high school biology or whatever. And so apoptosis is when that cell recognizes it needs to shut off and go away and allow digestion.
And so cannabis, I know you're very excited, Elisabeth, so you're going really super fast. Okay, so just take a breath.
Tumor cells lose the ability to turn off.
Right, exactly. Okay, so you lost me there. What did you just say? I'm sorry.
So that whole apoptosis, when you have a cancer cell, it loses its off switch.
Right, so the cannabis actually helps the cell, the cannabis helps the cell turn off and die.
Right. By activating the right receptors on that cell membrane, now we can reprogram that cell to recognize that it needs to auto-digest and go away.
And I have actually seen this in x-rays where the person has been like I had a client who had ovarian tumors and they were like golf balls. And she was doing cannabis is medicine, and she went back to her oncologist, and all of a sudden it was not like a golf ball. There were like tiny quarters in her. And he thought, at first he said to her, oh, it looks like the cancer is progressing. And then he was like, wait a minute. What is going on? It was the first time he had ever seen it, because chemotherapy will kill the cancer externally, like from the outside in. And cannabis literally kills it at the inside of its cell and allows it to die outward. So it literally eats it from the inside out.
Well, what's happening there is that it's allowing for the body to go through what it normally does in apoptosis, which is triggering that cell to die. When the cancer cell allows apoptosis and it dies, guess what? Tumors shrink.
Oh, right.
The other thing that's happening here is that it's anti-neogenesis, and that means generating blood supply and life. And when we strip that ability away, the cannabinoids actually will enclose in a way, somehow not allowing that cell to get nutrients. And when we inhibit angiogenesis, then we're not allowing that cell to get the nutrients it needs to exist. And then anti-proliferative properties, there is something about the way the CBD and THC is altering the gene expression inside the cell that it stops it from spreading. So these are all the anti-cancer properties that traditional, conventional, allopathic, chemotherapy, all of these things are trying to do. Immunotherapy, they're trying to do the same things. So that's why this should
only work. One huge difference is between that and this is that everything dies with it when you're using a chemical, because you are basically a plant. And when you pour Roundup on yourself, which is what chemotherapy is, you kill everything, not just the weed. And cannabis can be very targeted in killing the weed in the body while it's strengthening the rest of the system. And that is something that chemical medicine cannot do for us.
Correct. Yeah, I mean, conventional medicine has a place, and
absolutely. In no way do we want to say that it doesn't. That's why we are the clinical alchemists, because they both, there's nothing greater for diagnostic than Western medicine.
And what I can do through holistic caring with my one-on-one appointments and our nurses and our client programs, our patient programs, is to teach people how to bridge this and use both conventional and cannabis healthcare. And that's the whole idea, using these side by side, because then you get the benefit of both. And a clinician like me can help you walk both sides, because I understand all the meds and the treatments and everything like that, as well as this side in plant medicine. So that's the preclinical stuff, but we know that cannabis can absolutely reduce nausea and vomiting from chemo and radiation therapies. It can reduce pain, it can reduce anxiety, and help people be at the dinner table, be able to be with their family, watch a movie, and maybe even laugh. That's what the cannabinoids can do.
Have a quality of life as you go through treatment and you heal yourself.
Yeah. Alzheimer's and Parkinson's, we're looking at this and going back to the neuroprotection. This is neurodegeneration, right? So when the nerve cells are dying, we are getting Parkinson's, we're getting Alzheimer's, we've got plaques. THC might strip away the beta amyloid plaques in the brain, and slowing the progression is all that neuroprotection. Same thing with Parkinson's. We can keep that brain alive. It can maybe stimulate a little bit of dopamine, but it also helps with acetylcholine and movement and that sort of thing. And on MS, the spasticity that people have, THC is a good muscle relaxant. It's able to help us in that way to be still and to get those muscles to relax, so that you can stretch, you can do physical therapy, you can
and not have as much atrophy in the muscle body, because MS is very atrophying, right? So the cannabinoids are very helpful in reducing that.
Mm-hmm. Yeah. And, interstitial cystitis, that speaks to the inflammatory process. These people have that a lot, and cannabinoids can help with that. Pain and depression. Chronic pain, think about, you have generally 3 different types of pain in the body. One is nociceptive pain. So like from my shoulder to the brain, there are signals. THC can turn down the volume on that pain. Neuropathic pain, when we've got pins and needles and where we've got fire in our hands and our feet, or anywhere else that you have neuropathy pain. Cannabis and CBD, THC can balance that out and quiet that a little bit. And then also a central pain like fibromyalgia and that sort of thing, where there's an emotional component. CBD, THC work together to activate and stimulate serotonin, calming you and lifting your mood, quieting some of that emotional dysregulation. That helps with the central nervous system and the overall pain. And it boosts the efficacy of other drugs. So going back to, I used to take 8 Motrin a day, and then I was taking 4, and then I was taking 2, and then I was taking 1, and now I go weeks without a Motrin. That is how these cannabinoids can work over time. I'm 6 years into this. It's not going to be immediate. And then finally, just to wrap up, addictions. Like, how does CBD balance and soften the response for the addictive process in the body? We're not sure yet, but when you have CBD on board in rats, and they're studying this in several different places, the mice are not hitting the button for the heroin or the morphine or whatever they put in those pills, sugar tabs or whatever they're hitting the button for. The rats aren't doing this. And then when you take this into humans, there was a Hello MD study a couple of years back that showed 64% were lowering prescriptions, 40% were smoking less, 20% had less alcohol use. And then there were people that about 15% were not using some of the other more harmful drugs of abuse like cocaine and methamphetamine. So, what is that? We are still at the beginning of this, but we know that it is potentially
Let me take a stab at that from a non-clinical way.
Okay.
That why I think especially things like CBD are very helpful for people who are fighting addictions. And that is, with everything that you said, the bottom line is that it creates space in your brain. And when you have space in your brain and space in yourself, you're not immediately on your next point of trauma. So when you're using something like cannabinoids and cannabidiol, especially CBD, it's helping you just slow it all down. Take a breath, if you will. Just internally take a breath. No matter to what kind of firestorm is external around you, you begin to have the ability to have some space in your brain, is the way that I like to describe it. And that helps you make better choices. Like in a future show, we're going to talk about how cannabidiol helps you lose weight, because it adjusts the inflammation within your body. And that just automatically helps you make better choices with food and exercise.
Well, if your neuroinflammation is being softened, you're able to think more clearly. If your gut
Right.
inflammation is being reduced, you're functioning better. And guess what? All of your 70% of your neurotransmitters are made in the gut. People don't realize their
Right.
serotonin, their dopamine, all of that stuff comes from the gut. So we want to concurrently heal the gut as well as working with the cannabinoids.
Right, which is why we like to get people to dose through their belly button, and find out where their center of gravity is as well. So the takeaway from today, hopefully there was a lot of information for you guys, and Elisabeth is so smart, as you saw, so bright, and has so much to share. So in this feed, you're going to see how you can connect with her one-on-one, how you can work with her programs and get your own insight on things that you need, like you need some help figuring out how to get from point A to point B. If you're taking 57 pharmaceuticals and you would like to get those down to the ones that are really reliant to keep you alive, then Elisabeth is a wonderful practitioner to work with for sure. And that is why I really wanted to do this series with her, because she has so much to share, and she just put together this phenomenal body of work that I think, I'm big on teaching people to fish, not giving them fish. So the programs that Elisabeth has created are super simple for you to understand how your body works and how to do something about it. That's all I got for you.
Yeah, so I put in the chat the holisticcaring.com website with the patient programs that I have done, and I've created online patient programs where you could literally listen to a recorded lecture that is 60 to 75 minutes. And then that is, through YouTube, and it's all through an app. It's a course platform that I'll show you next time. We can walk through one of my courses, and
Yeah,
so you can watch it.
we're going to walk through the cancer program, and
Yeah.
like obviously this woman is very bright and speaks very fast. So the fact that they're already pre-recorded things, you could slow them down and listen and take notes, and really teach yourself quite a bit. So
Exactly. They not only get the lecture, but they get all the slides. They get all the slides. They get all the references that built that presentation, all the research, and then you open it in an app. You could watch it with your practitioners, your doctors, your family,
or
etc.
Elisabeth. You can just watch it and go over it with Elisabeth. She's available too, and her team of nurses. A few of her nurses work with us over here at Firebird. They're all outstanding. Every single one of them is world class. We're all here for the betterment of you. That's kind of what our mission statement is. Why we wanted to do this is because the only way that we're going to take care of ourselves is if each one of us takes care of themselves. So this is the way that we heal the planet. This is the way that we change things. We take personal responsibility and accountability for our health. We use things like that the creator has made for us, like this 5-finger healer, cannabis. And remember that we are designed by the holy creator to use this as medicine. So we're just still moving away from that whole horrible conversation of this is like, reefer madness and cannabis is bad and it's going to do terrible things for you. Again, I just want to, just speak her name, Crystal Peoples Stokes, and the amazing thing that she accomplished today. This woman has tirelessly worked her entire career to accomplish what happened today. So things are getting better, and plant-based medicine is a wonderful way to heal yourself. It's been this way for 10,000 years. So let's just do what we've always had. Anything that you would like to say, Miss Mack, before we sign off?
Just be hopeful. When I start my one-on-one appointments with patients around the globe, because through telemedicine I'm able to do this wherever people are, and they generally have a whole bucket full of different products they've tried that hasn't worked for them, and they just haven't had anybody to dial it in and say, here's what this does, here's how to take it, here's what that does, here's how to take it, here's how to put them all together, and here's how to take that with your pharmaceuticals. That's what I do every day in my one-on-one appointments. You can make an appointment at holisticcaring.com on the patient program tab. Scroll down about halfway, you'll see nursing services, remote consultations. And, I just really invite you to check it out. Look at our body of work and our team of nurses that are on the website as well. And then we work with Robin to send you back and say, here's the medicines, here's the real medicine. Some of the stuff at the dispensaries is not necessarily up to par with how I want to help people heal. It might be good to reduce a little bit of anxiety and tennis elbow, but it's not going to heal.
Right. And I just want to say that a lot of the formulas that we have at Firebird, like, well, I'm gonna knock them all over. Hold on. I don't want to hit them. Our tinctures like this, these were helped. Elisabeth helped me create these. She's the one who brought the need to my attention, and she pounded my head for years to make me make tinctures. So we work very closely together. When I'm creating a new medicine, she is my go-to. I am asking her, what do you think the milligrams per gram should be? How do you think this should work? What do you think I should mix it with? Blah, 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 blah. She's really my, on my right-hand side, on my left-hand side, telling me yes, telling me no, telling me you can't do that, telling me, well, I don't know if that will work. And then we all get to see it come out in a good way. So thank you so much, my friend. And we're going to be back here again next Wednesday, 3 o'clock Pacific, 6 o'clock East Coast time. Remember, these are recorded, so you can share them. You can move them around. You can find them on our YouTube channels. Holistic Caring, Firebird Touch Therapy. We are the Clinical Alchemists.
Yay. Namaste. God bless you.
All right. Bye, guys.
Bye.